All right. Now, Tiffany Miek will continue with her bail application on Monday in her son Jaden Lee's murder case. Miek appeared before the Roodepoort Magistrates Court today. She was arrested last week following weeks of investigation. The 11-year-old was reported missing in May and was found the following day, unconscious on the staircase of his home in Vleerhof, that's in the West Rand. This is not the first time we've had a situation like this then, of course, but Professor Naeemah Abrahams heads the SAMRC's Gender and Health Unit, and she joins me live now then to unpack this a little bit more. That's the Medical Research Council, of course, and she's a researcher herself then. Professor Abrahams, thank you so much for the time. Really appreciate it here. Let's just talk about South Africa's homicide rate compared to maybe other African countries. Does that explain where we're at and what perhaps causes this as we currently have it?
Thank you, Arabile, for inviting me. So the data on child homicide is not very easily available in other countries. It really depends on whether they report it and how they report it. In South Africa, we have been very fortunate in that we did dedicated studies to look at child murders in our country. What we can kind of make assumptions is that our rates are particularly high, but we only have really other high-income countries to compare it with. And there are very few countries that are similar to South Africa and those in Africa that provide their data. What we do know when we look at children that are murdered is that the age profile matters. For example, children is 0 to 17-year-olds, and we know in our country, many of the boy children in particularly who are adolescents are killed very similarly to how men are killed. So it mimics men on men violence. But so those are often not murders that are associated with abuse and neglect. And I think of interest is to know of all the children that are killed, the circumstances of that killing really matters, because we can then discern who killed the children and the circumstances, and we can do interventions. Now, it's the young children that are killed by people who are supposed to care for them. As we have seen now in the most recent cases, it's not surprising. The data we have in the Medical Research Council show that when children are killed in circumstances where there's evidence that there was abuse, and we call the child abuse and neglect murders, it is the parents. Parents are most often the carers who most often are the perpetrators of those killings.
Do we know why parents become the primary perpetrators or the largest array of perpetrators in this impact? Do we have a key reasoning? You know, in previous cases, and one that of course we followed quite vehemently on the channel, then it was about anyway that it was the supposition and the suspicion that it was because of the green eyes that the child had, because of the skin tone as well. So a sangoma may have been interested, etc. But that's not necessarily the situation across all of them, right? So what are some of the key factors that we could see?
So parenting, obviously, it is about people's ability to parent under difficult circumstances. So we know that the socioeconomic conditions in our country doesn't make it very easy for people who have children and have to raise them. We also, another factor is that child abuse, hitting our children, disciplining our children is common. It is an acceptable way to deal with trying to discipline children. And even though we have legislation against it, and we're not supposed to do it, for example, in schools, it is really a difficult thing to change and to monitor and to enact and to make sure to implement, because it's a norm change. We in fact have found, so when we looked at this child abuse and neglect murders over 3 studies, we actually saw a decrease between 2009 and 2017. So in 2009, there were the children who were murdered by in circumstances of abuse. They were that they represented about 45% of all the children murdered. This decreased to 25%, and we really tried to think very hard what changed from 2009 to 2017 that made this happen. It first of all tells us that it's preventable, that it can be prevented. Here is a decrease. But the decrease was the biggest decrease was in the very young children, the under 5-year-olds. And we think that the child grants were initiated, it wasn't initiated. There was a huge increase in the number of children that were covered. The government increased the age of the children who could be covered. And we think structural factors, such as improving people's economic position, makes a difference for parents to take care of their children and to take better care of their children. Obviously, there are many other factors. It's not a single factor.
Yeah.
But it's about, they often say a country's development is dependent on how we care for our children. And if we are still continuing to kill our children by people who are supposed to care of them, we in a really, it's not a good place to be in South Africa for children.
So if there was greater support, and I'm just trying to understand this, Professor, if there was greater support for whether it be young or older parents, just for parenting, given whether by government or other institutions, especially NGOs, do you think that would serve well for the process of parenting, that would see fewer deaths like we did between 2009 and 2017?
So we think it's one of multiple factors. We think that if your child matters to you, if your child, and you need to take care of your child now, if you are going to get, it's not a lot of money. Many child rights organizations are saying it doesn't alleviate poverty. It's still a small amount, the child support grant. But we think it did make a difference for some children to be treated better. There's food in the house. The parents' stress levels are not as high because there is a small income coming in. And if that child is dead, there's no income then. It's a very crude way of looking at it, I know. But we believe that one of the other roles could be improve healthcare, improve education of mothers. And we know there was a big change, and our country really struggled in many different ways from about 2015-16 onwards. And that probably brought about also a change in households as well. I
mean, mental health issues also play a huge part, don't they? And we talk about things like postpartum depression, psychosis, all playing a role as well then in child homicides. How big a factor is that?
It is a factor. We see a lot of children being dumped when they are born alive. And those are children that are really unwanted. Those are pregnancies that were unwanted. And so we haven't got enough data to tell us to what proportion of these women had postpartum depression in a way that they did something to their babies. But what we do know, it's very clear that the woman who dumps a baby after she's given birth to him alone, or she gave birth in a hospital and then got rid of the baby, and that baby dies, is that woman might not maybe have known about other options. There are other options other than to dump the baby. There are, and we need to be better at this. If a woman do not want, and she hasn't got the support, there is no father, there isn't family that supports her in raising this baby, she needs to be able to safely take that child to a place where she can anonymously drop that child. Now, there's very few of that in our country. But I think, so, pregnancies, why is it that women are having babies when we have free abortion services in our country? So many different aspects of society contribute to people's inability to take care of their children. And now I'm talking particularly about the very young child, the neonate, the newborn baby. And women should be offered, there's adoption. There's other ways other than to, but women are desperate. It's possible that they are far too desperate.
Are we able to talk about current laws, regulations, child protection services that are adequate in terms of responding then as well to the warning signs and cases of potential risk that may be at play instead of having the situations that we're talking about, which is whether the killings of children?
Yeah. That is an area that is, although we've worked very hard at child protection and trying to put in systems in place for children who are at risk to be picked up and to be flagged and to be assisted and to be removed. But we obviously children are falling through the cracks in the system. The safety net is not good enough. Children who are in school systems might have an additional support because the school and being part of an outside of the home could help. But it's under fives who are still with the family, with the mother and the parents that might not have the additional system to support them. So we need every part of society to be able to support children that are in need and to recognize children who are in need and to pursue that. It shouldn't be the case where it ends up as a police case. The mother has abused the child has an injury, the child's in hospital, it's a near death. It should be way before that. And mothers, society believe that a mother can't be bad, hey? We all believe all mothers care for their children, they love their children, and it's impossible to think that the mother could possibly hurt her child. But that's not really the reality for everybody. And like you said earlier, mental health plays a role. Not being able to take care of yourself, how are you going to take care of your child as well? So multiple factors at play.
Certainly, a whole host of these factors. Look, it's concerning to say the absolute least. Professor, thank you so much for the time. Really appreciate it. I think an educational lesson to all of us here, and a very necessary one then as well. Professor Naeemah Abrahams is the Deputy Director of the Gender and Health